So for the last 4 days, I've had the worst abdominal pain that I've ever had in my life. It was similar to labor and contraction pain, and I should know, I've had 3 kids. I went to the ER twice, and the last 4 days they did a CT, ultrasound, and blood work, and they told me they couldn't figure out why I was having such extreme pain. They discharged me and sent me home. Last night on day 4, I absolutely couldn't take it anymore. The pain was so excruciating in my stomach. It still is. TMI, but I haven't been able to use the bathroom for 3 days, and I haven't been able to eat anything for 3 days, not even water. Even water was causing me to feel like I was literally going to pop. Though last night, for a third time, I came into the ER again, and the doctor that met with me was a little snippy, and she told me, "You've been here twice. We found nothing. I'm not going to repeat any tests. I'm just going to give you some morphine and send you home. You need to see your gastro. There's nothing we can do for you. You've been sent home twice." And I looked at her and I said, "Absolutely not. You are going to do everything that you can do for me. I've been here twice, and if I'm here a third time, it should show you that there's something very wrong with me. I'm not coming in here for enjoyment." I explained to her I cannot eat anything. I cannot have any bowel movement. I can't pass gas. Even water hurts. When I move, I'm in severe pain. I can't do anything. I'm sweating. I'm shaking. You need to perform whatever tests you can, and I need someone to tell me what's wrong with me. So she kind of rolled her eyes, walked away, and she said, "Well, I'll see what I can do." I go for a scan that I didn't have the first 2 times, to check, my intestines and my gallbladder a little further with some contrast. And they do some blood work, and she comes back about an hour later with a look on her face, and she's like, "Well, I think we know what's wrong." And I look at her and I say, "I guess I'm not going home." And she says, "No, you're not going home. We found that you have a bowel obstruction, and we have to fit you with the NG tube in a short while, and we don't know if you need surgery. So you're going to be admitted, and we're going to give you some more pain medicine." And she says, "I think we found what's wrong with you today," and she smiled. And I just looked at her and I said, "This is why patients should be believed when they're told they're in pain. We know our bodies." I literally feel like I'm a pop. And, didn't get an apology at all, but I'm waiting on a bed now. I'm in a room in the ER, but it's a larger room. That was my wrist. Waiting now to be sent upstairs to my room, and a little nervous because I wasn't prepared for any kind of surgery. I'm in a lot of pain. They've given me morphine and Dilaudid, and I'm still in pain. Can't eat and drink anything, obviously, but I'm just really, I can't believe I had to come to the ER 3 times before they could tell me what's going on with me. But anyone that's had a bowel obstruction and had to get an NG tube and all that, I just want to know if you ended up needing surgery. Like, at this moment, I don't know what part is blocked. But yeah, I wasn't prepared for this at all. But advocate for yourself. You know your body. And if you've had bowel obstruction, again, let me know if you needed surgery or how things went for you. Well, the surgeon came to talk to me. Oh, this is bothering me so bad. This is my NG tube. It's suctioning out any stuff that I have that's not going down because of the block. The surgeon came and talked to me, and he told me that I have a small loop have a loop obstruction in the small bowel caused by a hernia. But they gave me the documents so I could read it for myself. And so he said that I have dilated fluid-filled small bowel loops in the left mid-abdomen, concerning for closed loop obstruction, such as internal hernia. So he came to me and told me that they will be doing a laparoscopic procedure to fix the hernia and everything going on in there in about an hour from now. Not what I was expecting. I was not prepared for any kind of surgery at all. So that's what's going on. And as I said in my previous video, you know your body. Advocate for yourself. They sent me home twice from the ER. I came back a third time and I demanded more tests be done because I couldn't take the pain in my stomach. It turns out I'm not crazy. I'm not overreacting. I actually have an obstruction. And now I'm going to need surgery. Out of surgery. Surgery started at 10. It finished around 2. The nurse said it took longer than they thought it would. I'm not quite sure what the surgeon did. He hasn't come to talk to me yet. I'm in a lot of pain. I believe it was done through 5 holes laparoscopically. All the nurse could tell me was that when they went in, my bowels were completely twisted. They were like flipped over. But she's not 100% sure what exactly he did. If he resected anything, or I'm not quite sure. So I have to wait for the surgeon to come speak with me. I'm in a lot of pain. They just gave me morphine. This is about the 4th or the 3rd day I don't eat anything at all. I'm not sure if they're going to have me eat anything, but I am drinking little bits of water for now. See what the surgeon tells me. So the nurse said, the doctor said I have to try and eat something to make sure everything's working okay. It's a liquid diet. So I'm gonna try my best because I'm in pain, and honestly, after 3 days of no food, I'm not really hungry. But I'm gonna try. And they also said I have to have some potassium replacement because my potassium was low, so I have to drink that too. So I'm just really eager to know what the doctor did. Guess I'll have to wait and see. I don't know, but I look a little yellow. It's weird. Oh. The anesthesia is wearing off. The pain is getting really bad. Really, really bad. About an hour ago, my hand started swelling up. It's the hand where I have my IV. It hurts. It feels hot and tight. So the nurse told me they're gonna have to take my IV out, change it, and I possibly need an ultrasound on my arm to make sure it's not a blood clot. My arm feels heavy, it feels tight, and it feels hot, so I'm a little worried, but I'm gonna try to stay positive. I'm just hoping that they do this as quick as possible. Yeah. Don't I look lovely? My grays are graying. Listen, I've been gray since I was 19. And I've been dyeing my hair all these years. I'm 44 next month. So, whatever. Who cares? Maybe I'll dye it, maybe I won't. The real question is, when am I getting out of here? I want my own bed. I had a really rough night. I haven't slept at all. At all. So, my arms, I don't know, it swelled up. They did an ultrasound, thank God it was negative. Still a little swollen, but they had to take the IV out of that hand. Try to get it in the other arm. I have extremely small veins, so they blew my vein twice in 2 different spots. They had to bring in the ultrasound machine to get this bad boy. They put, I think she said an 18, whatever that means. She said it's a big one, so they had to put that one in. I cannot wait to get that out. Oh, my filter. So let's take my filter off so you can see how wonderful I look. The second day after having emergency abdominal surgery for a small bowel obstruction and internal hernia. And when he went in there, it was really bad, he said. So let's see how I look. So this is how I look. I'm so tired. I feel like garbage. I haven't had any medicine since I don't know when. I feel like crap. My whole skeleton hurts. Besides where I had the surgery, my whole entire skeleton hurts. If you guys follow me, you know that I suffer from chronic pain due to being chronically ill, so I haven't taken any of my normal medications for like 3 days now. Everything hurts. I was supposed to take my methotrexate yesterday. Didn't take it. I haven't taken any of my pain medicine, any of my medicine for my muscle pain. I haven't taken the medicine for my tachycardia. The only thing they gave me last night is the diuretic for my IIH. The last time they gave me morphine, I don't know, it was probably like 12 or 1 in the morning. I'm in so much pain, but I just want to go home, to be honest. I'd rather be in pain at home. Hoping to go home today. Recovery is about a week, but I can't lift anything for about 2 weeks, so I don't know how that's gonna work. I have a 3-bedroom house to unpack. Wish me luck. Oh my god, I'm waiting on an Uber. No, I don't have anyone to pick me up. My family doesn't live in Florida. My children are home with the other parent. And we're not on speaking terms because, as I said, he decided on Tuesday he didn't want to have a family.
or anything like that anymore. And then Tuesday night, this happened to me. I started having pains and all that stuff. Wednesday, I suffered because I had to be a mom, had to cook and clean. Thursday, I suffered. Finally, Friday, I couldn't take it anymore. Came to the ER, and I had emergency surgery yesterday on Saturday. And a day later, I have been discharged. And I'm sitting on a bench outside the hospital waiting on an Uber. I am in so much pain. I had to put these gauze in between my pants and the incisions because they're rubbing on the incisions. And it's just Dermabond, so there's no gauze, no protective layer. I'm having a flare. This is a filter, but I know I'm having a flare. Let me take the filter off. No filter. Yeah, I'm definitely having a flare. I am chronically ill and I just went through a major surgery, so I knew I was gonna flare. My pain is gonna get 100 times worse as all the anesthesia and all the morphine that they have been giving me starts to wear off, which it is already wearing off. I'm in excruciating pain. All 4 of my incisions are stinging. They're stinging and throbbing at the same time. Unfortunately, I saw that the Uber is like a SUV, so I don't know how I'm gonna get in there. But yeah, the flare it's starting to kick in pretty bad. The pain is getting pretty bad. I can feel it. And how I can tell I'm flaring besides the pain is I get a butterfly rash, or I get the infamous autoimmune disease rash on my face. I'm just gonna go home and lay down in my bed, say hi to my kids, and I'm not gonna do anything else. I'm not gonna worry myself with anything that's gonna happen this upcoming week. I just have to get better and put my life back on track from there.